method, the stairs don't stand a chance.
Why my knee so pain? Stop right there. This is not a joke. This is a medical mystery. To solve this case, first we need to understand how a normal person climbs a stair. First, the hip and knee bend. This movement is called hip flexion and knee flexion, and it allows the foot to reach the next step. Next, the quadriceps muscle at the front of the thigh contract and strengthen the knee. At the same time, the gluteal muscle extend the hip and help lift the body against the gravity. The calf muscle then helps stabilize the ankle and support the outward movement. So, stair climbing is not controlled by one joint alone. The hip, knee, and ankle must work together in a coordinated sequence. Yo, let's go inside the knees. Inside the knee joints, there are three important bones that are involved. So, the first is the femur. The femur is the thigh bone, the tibia is the sciatic bone, and the patella is the kneecap.
But why do these joints does not grind together when I move?
Because the end of the bone, they are covered with a smooth articular cartilage. The cartilage will reduce the friction and allow the knee to move smoothly. Meniscus act like a shock absorber and help distribute body weight across the knee. Imagine two of these people is our bone. So without sufficient protection, the movement will become rougher like this. But when we have a cartilage and meniscus, it will help to reduce the friction and it will help cushion the joint as well. Ow! For this case, we will have three suspects. The first suspect will be temporary muscle fatigue. Possible, but it is normally improved after the rest. Second, I suspect is the bone fracture. Unlikely because there was no recent injury or accident. So, what I suspect the most is the knee osteoarthritis.
What exactly is a knee osteoarthritis?
Yeah, it is a joint condition involving the gradual deterioration of cartilage and change in other tissues within the knee.
This is a normal knee.
This is the osteoarthritic knee. So, as the cartilage become thinner and the joint change, movement can become painful and stiff. In normal climbing, the knee bends and strengthens smoothly. The person can usually climb with alternating step and good balance. But with knee osteoarthritis, the knee may become painful, stiff, and harder to bend.
So how do I know I have knee osteoarthritis?
Alright, to confirm the investigation, healthcare professionals may use an X-ray machine.
How does an X-ray help?
An X-ray it will produce an image of the bone. So in knee osteoarthritis, the image may show reduced joint space, change in the bone and bone spurs. However, doctors do not depend only on the X-ray. They also assess the patient's symptoms, movement, and medical history and physical condition.
What is the treatment for knee osteoarthritis?
Let me show you. First is the exercise and physiotherapy. Exercise and physiotherapy strengthen the muscle around the knee, especially the quadriceps, to improve support and stability. Medication may help control pain when advised by a healthcare professional. Knee brace support the knee and improve stability, but it does not rebuild damaged cartilage. Case conclusion: stair climbing requires healthy joints, strong muscles, and coordination between the nervous, respiratory, and cardiovascular systems.
To protect your knees, stay physically active, strengthen the muscle around the knee, maintain a suitable body weight, and wear supportive footwear.
Use the handrail when necessary and avoid rushing, especially when the stairs are wet or crowded.
If knee pain, swelling, stiffness, or instability continuous, seek professional medical assessment. Case closed.